Segue, to continue at once with the next musical selection or composition.
Segue, to make a transition directly from one section or theme to another.
To move smoothly and unhesitatingly from one state, situation, condition, or element to another.
Segue, to perform in the manner of the preceding section.
Segue, to make a transition from one thing to another smoothly and without interruption.
This is Segue with Dean Aldemaro Romero, a weekly program exploring the lives and work of the people of the College of Arts and Sciences at Southern Illinois University, Edwardsville.
Hello everybody. Dr. Jayme Swanke was born in Peoria, Illinois. She obtained her bachelor's, master's, and doctoral degrees in social work from Southern Illinois University, Carbondale. And today she is an assistant professor in the Department of Social Work at Southern Illinois University, Edwardsville. Welcome to Segue, Dr. Swanke.
Thank you.
It is unusual for a person to have all of his or her college degrees from the same place.
It is.
Was any particular reason why you stay in the same place all the time?
Well, if I may correct you.
Okay.
I have my bachelor's and master's degree in social work, and my PhD is in rehabilitation.
Oh, okay.
So when I graduated with my master's degree, I was hired as a substance abuse counselor at the DuQuoin Impact Incarceration Camp.
Okay.
And my graduate school mentor said to me, you know, you're young and you're stupid, and I think you should go into a PhD
You were
program.
told that?
You should go into a PhD program. Don't think about it, just do it. Call this man and tell him that I recommended you. So I called my future advisor at the Rehabilitation Institute and set up a meeting and submitted an application and was accepted. So I found that while it in some ways kind of hindered me because I had a very small network coming out of a doc program, but at the same time I had a really strong network because I had developed a lot of really good, strong relationships at Carbondale that really supported me through the process of getting a PhD and then ultimately getting onto the job market. But it is somewhat unusual for somebody to come out of one institution with all degrees.
Okay. Well, since you went to college initially from the very beginning with social work, it was your intention, let's say from the time that you were a high school student, to become a social worker?
It actually was not my intention. My intention was to go to law school and become a lawyer. And I started out in college as a business major in accounting. But I'm not a very strong math student, so I don't know why I thought I would do well in accounting. So I promptly changed my major to social work because there's very little math. And I would be able to maintain a high GPA to get into a good law school. And after my first internship in the BSW program at Carbondale, I decided that I really enjoyed working with people and the profession of social work. And I graduated a semester early with my BSW and decided to pursue a master's degree and defer law school for a year because I needed to do something in order to stay on my parents' insurance. So I went that route and obtained the MSW and thought I want to go into practice and not become a lawyer, and then pursued the PhD. So this was never really my intention to go this route. It just kind of happened.
And then now you have specialized on substance abuse. Why you chose that particular area?
My concentration in my MSW program was health and mental health. And I found that I especially enjoyed working with people who struggle with substance use disorders because of the element of recovery, that for some people there is this hope that they can get better and they can live a life free of drugs and alcohol, and make a completely, turn their life around completely, make changes in who they spend their time with and how they live their life and the choices they make, the jobs they have, the place where they live, where they hang out, all of that. And to see people make those changes, just to be a part of that process with them, it really, it really
impacted you.
It impacted me a lot, yeah.
Okay. Now, in order to clarify this to our audience, when you talk about substance abuse, the first thought is about drugs, hard drugs. But would you include within substance abuse alcohol and even nicotine?
Yes, definitely alcohol. Nicotine is definitely a substance that is classified as a substance that can be diagnosed, as an addictive substance. Gambling is now included in the DSM-5, which is the new diagnostic manual that came out in May.
I didn't know that. Okay. Okay. Now, is there a real difference between drug abuse and alcohol abuse?
The criteria for drug abuse and dependence is the same as alcohol abuse and dependence.
So basically, we can say it's the same problem, because now that you mentioned that gambling was now included, is quite striking actually, because you are not taking a substance, but you're becoming addicted.
Right, and you get a lot of the same high.
Now, will you link these type of conditions to, let's say, try to control your impulsive behavior? Is there a direct link between the two?
Trying to control. For somebody who has like a substance use disorder, a lot of times when they recognize that their use is getting out of control, they may try to rein it back in. It may look something like, I'm going to go out and only have 2 drinks tonight. And then oftentimes it turns into 5, 6, 7 drinks. They can't control it. It becomes a compulsive behavior.
But if you, let's say you have some type of impulsive condition, that doesn't necessarily mean that you are going to become addicted, because you can, in certain ways, allow that type of behavior to take a different route that is not really harmful to your health. Is that possible?
Such as?
Like, for example, for cleanliness. This person is impulsive, that everything has to be clean all the time, no matter what, that kind of impulsive behavior.
But if that impulsive behavior begins to impact your relationships with other people, or it impacts your ability to go to work, I can't go to work and do my work unless I know that my house is, completely clean, or it's impacting my relationship with my family, or it's inhibiting my ability to do other things. Okay,
so the definition is really broad then.
Yeah. Okay. You can have issues in other aspects, and some of that would be classified under obsessive-compulsive disorder.
Okay. How early in the lifespan of an individual, let's say in childhood, can you detect that the person has this kind of inclinations, this kind of behaviors?
I think it depends. It depends on the individual. As far as drug and alcohol abuse and dependence go, it really depends on when the person starts using. The younger an individual begins using, the more likely they are to develop an abuse or dependence diagnosis. And it depends on their body chemistry and how they react to the substance. One person could smoke marijuana and it could make them feel, very tired, and they don't like the way it makes them feel, and they could say, I have no idea why anybody would ever want to do this, and never touch it again. For somebody else, it could be like, jackpot, this is the greatest thing ever. I want to do this every day for the rest of my life. And it flips a switch for them, and, that person has the chemistry that they want to use that every day. And
the reason why I was asking this is because when you go to Europe, particularly Mediterranean countries, it's not unusual to see youngsters having a cup of wine over dinner.
Right.
And that here is like taboo. But it's fairly common over there, and you can pretty much be sure that in the vast majority of cases, those kids will not become alcoholics.
There are 4 things, and I just went to a conference on Tuesday, actually, and they presented some research on this, why we tend to have here in the United States, we tend to have more abuse and dependence on drugs and alcohol than other countries, say, over in Europe. And part of it has to do with our culture and how we view alcohol, for instance. Over there, alcohol, in some cases, is viewed as a food. We have a drinking age here, whereas, a legal drinking age, 21, versus over there is no legal drinking age, or the legal drinking age is 16 or 21, so it's not as taboo. Where here, at 21, you want to do what you can't do or what you're not allowed to do. There's 2 others, and they escape me off the top of my head, but it's some of those types of things that then those regulations that then lend themselves to creating a problem.
And that's the thing that you see here for spring break, college students who are under 21, going to Mexico because they know they can do anything they want. So I'm not sure that the 21 legal age is a solution to these problems rather than education.
Oh, that reminds me of one of the other ones you have over here. You look at the social settings where people drink here, it's dark bars where, it's dark and smoky. Well, not necessarily smoky here anymore, but you can't really see who's around you or what's happening. Whereas over there, you might go to like Oktoberfest in Germany where it's family oriented and it's, everybody may be,
beer,
but nobody is really drunk. Where you might go to an Oktoberfest here and people are
kind of a stigma thing.
Yes. And so the social aspect of it is very different. So I think that our culture has kind of set it up so that drugs and alcohol are abused more because of the way that we regulate them.
The puritanical approach to that. Okay. The other reason why I was asking this is because we have the cases of pregnant women, of course, who take drugs. And I was wondering if that drug that once goes into the system of the unborn baby makes those individuals prone to addiction no matter what once they grow up.
There are drugs that definitely, and I'm not well versed in that area. There are drugs that cross the blood-brain barrier and the placental barrier and are exposed to the fetus. And then the fetus, after the baby is born, the baby will definitely go through withdrawals, substances like heroin, methamphetamine, You'll see a baby that is very agitated, fussy, go through withdrawals, very lethargic. And that child will most likely have a lot of developmental problems as well. As far as being predisposed to addiction, I have read in the literature that some studies show that alcohol addiction does not cross gender. So if a father is an alcoholic or has an alcohol dependence diagnosis, he can pass that on to a son, but will not pass that on to a daughter. If a mother...
Okay, that's interesting.
Mother could pass it on to a daughter, but not to a son. Yeah. Some researchers suggest that it's more, a nurture side effect. So you learn it from your environment as opposed to it being a biological, genetic thing. So it just really...
It depends.
It depends,
There's a
yeah.
straight answer for that. Okay. Now, talking about methamphetamine, you recently published a paper that I have here, and I'm going to show you to the webcam for those in our audience who are watching this interview, titled "Employment Among Methamphetamine-Involved Clients." And basically, I don't know if let me get it closer to the camera here so people can see it better. And basically, I found interesting how this type of addictions can have a serious implications in terms of the employability of individuals. Tell our audience a little bit about the results of this particular study.
Essentially, that study stemmed from my dissertation research, and what I did was I used a national data set, the National Survey on Drug Use and Health, and I used several independent variables to predict employment among people who had reported methamphetamine use, and to determine if there were any predictors of unemployment, what variables were significant for predicting unemployment. And the only significant predictor of unemployment in that study was among persons who had reported methamphetamine use was serious psychological distress. So persons who had reported methamphetamine use as well as serious psychological distress were more likely to be unemployed than anybody else.
Okay, well.
So this raises another issue that has been an issue in substance abuse treatment as well as mental health for a long time. And it's what do we do with folks who have serious mental illness as well as substance abuse disorders. Because mental health, typically, they don't want to touch folks that are under the influence or who are in active addiction, and substance abuse treatment centers are not typically staffed to deal with people who have serious psychotic disorders or severe mental illnesses. And those folks typically fall through the cracks. And it shows in this study that they are the ones that are in need of treatment, and they are more likely to be unemployed and uninsured.
I see.
So
they're pretty much at the bottom of the barrel when it comes to the social status of the condition. Okay. Now, everybody knows that in the last few months, a number of states have approved the use of marijuana.
Mm-hmm.
And I was wondering if you have been looking at the legislation coming out of those states in order to make sure that the recreational use of marijuana won't have or won't create the conditions for a large number of people becoming addicted to the drug. Is that something that you think the states are considering in the legislation?
I'm not really familiar with the legislation for the recreational use of marijuana. As far as marijuana goes, I have looked more into the legislation for the medical marijuana use, and I know that the states that have the medical marijuana use, it just varies so much that you better not get caught in one state with your medical marijuana from another state, because the legislation varies so much that you might find yourself in hot water.
So do you feel that we need a federal regulation to make the rules easier?
I'm not really sure what we need. I'm not sure a one-size-fits-all works in all cases, but at the same time, even in some states, different counties have different policies. I think out in California, if you live in an area that you're 50 miles from the nearest medical marijuana prescriber, you can grow your own, but you can only have so many plants. Well, who's regulating that?
Yeah. And not to talk when you go to Europe, particularly Western Europe, where there are countries like the Netherlands where the regulation for marijuana is virtually non-existent. Okay, well, one of the things I found a complicated matter when I was preparing for this interview was the definition of drug abuse is so different, whether you are dealing with public health definition, mass media definition, medical definition, political, even criminal definition. Isn't that part of the problem to come up with a better regulation or better understanding of what substance abuse is all about?
I would agree with you. And I think right now the clinical field is kind of up in the air because we're between the DSM-4 TR, which is the previous clinical diagnostic manual, and the DSM-5, which just came out in May. And they have completely turned the diagnostic criteria for substance abuse and dependence on its head. And we no longer have an abuse and dependence diagnosis, which is what I have. That's the only criteria I've ever used. And now we are moving towards a spectrum diagnosis of mild, moderate, and severe on a 10 criteria basis. And nobody's really certain how that's going to work with insurance. And then we have the Affordable Health Care Act that's going to be coming into effect, and how is that going to impact practice. So there's a lot of iffy things out there that's going to impact substance abuse practitioners right now. Not only all of those definitions that you talked about, but the stigma that comes along with it and how the public understands substance abuse and dependence, and how we throw around the term addiction or addict. Addict is not really a term that I use. I look at that as more of a label. People want to call themselves an addict. By all means, I don't use that term. But there really is no one definition, I guess.
Okay. Also, I guess, things also vary from country to country, because I remember once talking to an Australian who told me that for a long period of time, Aboriginals, that is the native Australians, were forbidden by law to consume alcohol because they were found that, biologically speaking, were had less tolerance to the effects of the alcohol. Is there any study in this country where we have such a mixture of race in terms of substance abuse differences among different ethnic groups?
I am not for certain about any studies. Now, I have heard from other folks that I know personally who have Native American descendants and Asian descendants. They actually lack the liver enzymes to digest alcohol, and they are actually allergic, so they will break out. If they drink alcohol, they will have almost like break out in hives and have like an allergic reaction or get very bloodshot eyes. Some women are not able to digest alcohol the same way men are, and so they tend to have a lower tolerance because they lack the same level of liver enzymes that men
And that
do.
helps explain why the difference among individuals. So there is not a single rule for everything. You also published another paper about autism. And I would like you to explain to the public about what you could call the cyber mothers, because I found that term really fascinating.
This paper is actually one in a series that we've written. The data, the cyber mothers, are actually mothers who have blogged about their experience raising children who are diagnosed with an autism spectrum disorder. And this particular paper talked about their experience and why they blog about their experiences of raising children. The blog data we found to be very rich. We used 18 months worth of data for this study, and we found that the mothers found a lot of social support in this virtual network. They tended to connect with one another. We have a mom living in rural Iowa that would log on and she would hear about some resource that another mother in, a metropolitan area of North Carolina got for her child and found out, oh, my child's entitled to this under IDEA. Like, I should go and advocate for my kid to have, this same resource. So they really empowered one another. They talk about how this virtual space becomes like an extension of their home and group therapy sessions, and they, vent about the social stigma that their child goes through day in and day out, and dealing with school professionals and physicians and therapists and occupational therapists and all of these people that they feel like, I may not be an autism professional, but I am with this child 24/7. Like, I know more than what I'm given credit for. So this article is kind of written for professionals to be an insight to this is how these mothers feel. So
Okay, well, it's interesting to see how the things are changing. The social media is changing a lot of different things at the same time. Well, thank you very much to Dr. Jayme Swanke of the Department of Social Work at Southern Illinois University, Edwardsville, for this interesting conversation about alcohol and drug addiction in America. And next week, we are going to have Dean Gunderson, a student at Southern Illinois University, Edwardsville, who just came back from Cuba, and he's going to talk about his experience in that island. So stay tuned.
This has been Segue with Dean Aldemaro Romero, a production of the Department of Mass Communications at Southern Illinois University, Edwardsville. All rights reserved, 2013.